It's my honor to welcome to the podium Anurag Saxena, Principal and Head for Digital Health Consulting, IQVIA. Ladies and gentlemen, kindly put your hands together for Anurag Saxena.
A very good afternoon to everyone. Uh, Before we start, right, let me just clarify. It is called IQVIA. It is not IQVIA because some people tend to think it's a word. IQVIA was created through a merger of IMS Health and Quintiles, right? So that's how we created IQ and VIA is the way forward, right? So we are known as IQVIA for the future reference. My name is Anurag. Thank you for the introduction. And I'll be talking about some suggestions that we have for digitizing the healthcare landscape in India. Before I begin, let me quickly introduce IQVIA. IQVIA is the world's largest healthcare technology and consulting provider. We are listed on New York Stock Exchange, and in India also, we are probably the largest employer in healthcare with about 25,000 employees. We work across the spectrum in healthcare. We are market leaders in some of the segments that we operate in, including public health consulting, and we are investing heavily in expanding our footprint into India. We are working very closely with some of the larger transformation in India, including the National Digital Health Mission or Ayushman Bharat Digital Mission as it is called. Right, so first let me set the context on the presentation topic. The topic is that how do we improve digitization of healthcare in India. So just to give a quick overview, right, I think some of you may be already familiar with this. India is a very fragmented market. If you look at the mix of healthcare facilities, large facilities, corporate hospitals have been able to digitize to an extent, right? Most of them have been using some sort of software applications. But if you look at the bottom of the pyramid, which includes primary healthcare centers, small doctor setups, individual clinics, right? They have not seen that transformation. And different stakeholders in this entire ecosystem have different sets of challenges. If I go back 2 years, India just had a blueprint, right? We did not have anything on paper, anything which was working. And then the government launched Ayushman Bharat Digital Mission, or NDHM as it was called at that time, where the idea was to implement what was there in spirit in the National Digital Health Blueprint and to make concrete highways for creating a digital health ecosystem, right? So the idea was that we wanted to solve the problem of lack of interoperability in the country, because if a patient traveled from one hospital to another, there was no sharing of data possible, right? So if an Apollo customer or a patient went to Medanta hospital, the data could not be interrelated, right? Or he had to carry physical files. Then we had lack of standardization. We did not have healthcare standards which are globally followed. We did not have too much of budgets available if you look at small facilities or medium facilities, right? And that is a problem that even now persists. If you go to any village, you will find that PHCs are completely manual today, right? So there is no way they can achieve transformation without having technology in place. Even the solutions which are there in large hospitals, right? They are not doctor friendly, right? Because a doctor will find it very difficult to go to a desktop, make entries for EMR, and start generating medical records electronically. And there was no mobility that we have, right? So these are some of the challenges that we have even now, and IQVIA is investing heavily in solving some of these challenges. So I wanted to just talk about three major disruptions that have a very strong potential to change the market. I think we have seen a lot of presentations today that talked about ABDM, and since we have been working very closely with the NHA on this mission itself, we have a lot of ideas on how ABDM is going to revolutionize the market. We continue to provide rollout support for ABDM even now. There is a large team that supports this program currently. The second transformation that is going to impact is availability of affordable and accessible solutions, especially for the bottom of the pyramid, right? If you look at the slide before, there are thousands of facilities that do not have access to any software today. They do not have the budgets available to embark this digitization journey. So how do we make it affordable? How do we create a plan which is as simple as buying a Netflix subscription, right? Especially for the small doctor clinics and PHCs and CSCs. How do you simplify that entire procurement process? The third challenge which I spoke about is solution not being doctor friendly, right? So how do we embrace mobility is another suggestion that I had. And I'll talk about each of these themes and disruptions in the subsequent slides. So the first topic, I think we have seen enough of ABDM, but just to give you the summary of ABDM, right? People have spoken about what ABDM is, what they are trying to do, but these are the three transformations that ABDM is going to bring, right? One is interoperability of data, because as a patient, if my data is not getting aggregated, then what is the use of that data, right? If my data still sits in silos and I'm not able to use that, or as a doctor, if I'm not able to do analysis of patients' historical records, then there is no use of data, right? So the first transformation is health information exchanges being created and data being made portable and interchangeable with patient's consent. The basic design principle remains that patient is the owner of his own data, right? So when I authorize my data to be shared with the doctor, then only he can view my records, right? So that is the first transformation. The second transformation is unified health interface, which means interoperability of services. So the first transformation talks about only data, but how do you make services interoperable? So as an example, if I am a Practo user and I want to do a teleconsultation with a public sector application, let's say a CDAC application, right? Today that is not possible, but with UHI that portability of services will also come in. So you can use any service provider and you can consult with a doctor who is doing any other application. So that is the second transformation. The third transformation is health claims exchanges, which is transforming the insurance sector also. So if you go to any large hospital today, you will find that they are just scrambling for emails, they are just uploading papers. There is no interoperability of insurance providers also, right? So how do you make claims data interoperable? How do you standardize that? Is the third transformation that ABDM will bring about. The impact, I think, is known to everyone. Every ecosystem player is going to be impacted in a big way. So as a citizen, I'll have access to choices. As a doctor, I'll have access to longitudinal health records. As a pharmacy, I'll have more market opportunities. As a payer, I'll have more standardization of data. There could be analytics built on top of it. For providers, the possibilities are unlimited because you are getting access to more patients. I think in the previous discussion I heard that there is a lot of spare capacity available in hospitals. So how do you fill that gap? How do you service customers outside of your territory? Right, so a doctor sitting in Goregaon could do a teleconsultation with a patient in Kerala, right? So all that will be feasible. Pharma companies will also be able to standardize. We are also talking about extending the concept for supply chain management, etc. in future. So I think overall this transformation is going to expand the market. There are studies which have actually described that the impact could be as big as $200 billion. So the market could be expanded by $200 billion in healthcare itself by creating more opportunities in healthcare, especially by using digitization of data, right? This is an example of how ABDM can be used to create citizens' longitudinal health record. So whenever I visit my nearby clinic, whenever I visit my, when I go for a test, I wear a watch which generates data. I have my vaccination records and COVID. If you can create a single view of all of that, right, and provide that view to the doctor, he'll be able to understand what is my problem, right? What is the pattern which is available, and it could actually improve quality of healthcare going forward. If we anonymize this data, this is also going to help decision makers in policy making. This is going to help in clinical research, right? So the use cases are infinite, but this is just one sample of the benefits that can be there for a citizen. So I'll have access to my mobile application, which provides all of that. I don't need to look at paper-based records. I don't need to scramble for information. Everything is linked to my Aadhaar, which is my Ayushman Bharat Health account, and accessible on my phone, which I can share through my consent, right? Nobody can steal my data. When I provide my consent to a doctor, he can view my records for a limited duration, and then I can withdraw that consent also. The second transformation I spoke about is creation of a SAS model, and this is specially targeted at small clinics, PHCs, CHCs, right? So there are two different sets of customers that we're talking about. One is private sector, which is educated doctors who use WhatsApp very regularly, who have access to smartphones, and they know how to buy things online, right? That segment, if you simplify and create packages for them, they can maybe pick and choose from an overall package of HIS and EMR. They can choose the module that they need. They can add to a cart and pay electronically and get started, right? As simple as buying Netflix. The second segment is the public sector segment, which has its own problems, right? For public sector guys, it's very difficult to procure things without following GFR guidelines, right? So if we create a plan and host it for a public sector undertaking, or maybe put it on government e-marketplace, that can simplify things for them to procure solutions. And I think this is one of the suggestions that we had for government of India as well on how to transform PHCs and CHCs. Because if we go for a state-wide transformation of hospitals, the project value could be at least 100 crore, even if we talk about a small state. Very few states have that kind of healthcare budget for technology, right? So what we need to do is break it down, create it affordable, very simple for government guys also to procure, put it up on GEM, put it up on the empaneled rate cards, and simplify the procurement process. The third and the most important piece, and I think this is something that we are also showcasing to the outside, right? If you see our booth, we have put up one solution which is very much in line with this recommendation that we have, which is mobility. So what we have seen is, doctors, if you provide them mobility, there is 100% adoption by them. And we have seen success stories in India as well. I'll not name clients, but there are very high-profile hospitals which are providing high-end services in India also, and they are using mobile EMR platforms. We have seen 100% adoption by doctors in those hospitals. We have seen 100% adoption by patients also, because they get access to all the information in the right place, right? They don't have to wait in queues. They can do multiple things by using these kind of applications. In fact, what we have also seen is there is a significant improvement in productivity. So these are some statistics from one of the deployments that we have, right? So we have seen in a very large hospital with about 1,000 beds, that 50% more time is available for physicians to be spent with patients, because if you provide them mobility, they don't have to do data entry kind of activities, right? So they can just scroll on their mobile phone application and do all that they need to do, right? So looking at the EMR, generating prescriptions, taking decision on discharges, looking at the historical pattern of drugs being allotted. Similarly, nursing staff has been able to spend more time. We have actually seen revenue also getting improved, because in some cases revenue leakages happen because nursing staff do not have access to paperwork, right? So they miss out on some billings also, especially in private hospitals. What we have also seen is there is a significant improvement in turnaround times. There is a significant improvement in productivity of other ancillary healthcare professionals, right? So all this can happen if you provide them a mobile interface. So this is a very high level overview of the platform that we have showcased today also. I'll invite you to the booth that we have outside, right? We can in fact schedule a demo. My colleague Padmaraj is also here, and we can tell you more about this solution. But this is one of the disruptions that we are investing in for India market. And even for SAS, we have tried to create offerings for this market, right? So as IQVIA, we are contributing in our own small way in creating these disruptions that can help in digitization of healthcare in India. And if you have any questions, we are available outside. Feel free to have an offline discussion. But I think this is just the beginning for India, right? The way we leapfrog the world in digital identity, the way we leapfrog the world in payments, I think healthcare is the next success story that's going to come up. Thank you.